you so much, and honestly what a pleasure it is to be with you all this evening. And as I said, you would not think that this was down here and we could get all these people in here. What a list of organisations. And I think the first thing I want to say is just a massive thank you to all of you for the work that you do, because it is invaluable, and far too often I think it flies under the radar, unseen, unheard, and that is, I think, the story for a lot of people who are either cared for or who are carers themselves, have caring responsibilities. I think this is something that has been on our radar, my radar as Mayor, for a long while, both because of the awareness and the work that we've done with Newcastle Carers and with some of the other organisations who are present here tonight, but because also some of you have came along and advocated at some of the hustings and of other events during the election period and have been in touch with us since. I think as an organisation, we're trying to step up to the plate, because actually I'm Mayor for the region, but we employ only 300 people. So we've signed the Carers Charter ourselves, which is fantastic. And as a result, we'll be offering all of that flexible work and all of the support that we can for our members of our team who find themselves with caring responsibilities and who want to be at work. Some other important things to mention: we are running a Trailblazer, which is all about getting people back into work or helping them to stay in employment, and carers are a really key part of that. So we've invested £1.5 million into that, which is fantastic. And then our skills boot camps, around 555 people who have taken part in those boot camps are people with caring responsibilities. So we're trying to make the world of work and all of the other services that we have in the region more accessible and easier for people with caring responsibilities to either access or to take part in, so that it isn't quite so isolating, and so that we are highlighting the experiences that you all have. So with that, I think we've got about an hour, maybe it's a smidge more. I'm a terrible chair, so I'll rely on all of you to keep me to time. And I think this should just be a conversation, because although there's plenty of you here, it's a pretty small room, and we can have a back and forth and a conversation. I don't think it needs to be too formal. I've got a list of people who want to ask a question, and I can go through this list, or you can pop your hand up. I don't mind. I'm totally open to however you want to do it. It's your time, it's your space, it's your place. And beyond that, we should probably just crack on. The other thing I should say, we do these things, right, and these we call them Mayor Meets. I think it's very snappy. We also had a thing last week, which was a cuppa with Kim. We're getting good at these names. And I think people think the whole point is to come and ask me questions. So I am more than happy to do that. I'll answer whatever I can. If I can't, I'll find out. I'll come back to you, all of those things. But part of the reason that we do these is ideas as well, because this is a really big region. I think it's the best place in the world. You know, we are 3,500 square miles, 2.1 million people, the best people anywhere in the world. It's beautiful. We're very lucky. But because of that, I can't know everything. You know, I can't know all of those people, all their experiences, all of those places. And so we're always looking for really good ideas as to what you think we should be doing and how you think we should be spending our time and anything you think we're missing. And so I want you to know that this is for that as well. So I'll answer your questions, but I think if you've got an idea and you want to share it either here or after, then I'm all ears. So should we crack on? I've got Lyra Lumley who wants to go first, I think. Hiya. That's right, you get on that chair.
How can you help to ensure all education settings are providing the same level of support and awareness for young carers?
I think it's a really, really good question, and something that we're really aware of. Our young carers are really important to us. We are doing some work actually with Newcastle Carers about the support, one-to-one support for young carers in schools in Newcastle, and that's running now, and we've had real good success with it. I think you're right though, it's about how we take that work that we might be doing in Newcastle and make sure that it goes into other parts of the region too. So what we quite often do is try something out somewhere and see how it works, and work with people like yourselves who might be able to access that support, and then figure out how to make it into other different areas. So how we might take what we're doing in Newcastle into South Tyneside or North Tyneside or Gateshead or Sunderland or Durham, so that we do have the same opportunities wherever we are in the region. And I think that's one of the really good things about this partnership that the care support organisations have formed. So rather than Newcastle Carers doing their thing, and where do you live?
South Shields.
In South Shields.
Yeah.
And South Shields, young carers doing their thing, actually everybody working together and being aware of what each other are doing and learning from each other and learning from you. So we're doing it already in Newcastle and we're going to do more across the region. Okay.
Thank you.
Thank you for your question. Right. Next one I've got is Yvette.
Hello, that's me.
Oh, hello. Hi, Yvette.
Hi, yeah. Thank you. Just make sure my coffee's not there. Yeah. Hello, Maya. So I'm currently a carer for my son, and I'm also disabled myself, which adds to the challenge. I want to share how I feel about always having to repeat myself as a carer. This is challenging as professionals all want to know the issues I face and problems I'm having. There are inconsistencies about how information is shared, and often I feel like I hit dead ends as I'm sent to services that don't communicate with each other and turn me away sometimes. This lack of communication and consistency is right across health, education, and all services I access. It is hard, therefore, to know what support is available or who I need to share information with. I feel like I am being pushed from pillar to post often, and it can be quite exhausting. How will you work towards ensuring that as carers we don't have to constantly repeat painful information and create a support for carers that is consistent across North East Combined Authority area?
I think it's a great question, and thank you for sharing your experience. And I think I hear things like that all the time. I share a story about, it was actually because before I was the Mayor, I was Police and Crime Commissioner for Northumbria, and I went to visit a community organisation, and what we were doing at the time was crime prevention. But we were also recognising that, our residents have really complex needs, and sometimes in households where you do have a lot going on, you might have a young person who needs the support to prevent crime. So that's why we were there. But we were in Egbert's house, which is in Gateshead. And they sat me down and they said, look, this is our problem. And it's exactly what you described. They said, look, we've got this family, and this is a real family. And we've got mum who works and also cares for dad and one son. We've got dad who can't work and has complex medical needs. We've got 3 children, each with different needs. And this family are dealing with 80 different professionals in their lives. 80 different professionals. And this is, I think, something that we hear all the time, and it's not an easy fix. I think what we try to do, and what we'll do after this, is take your experiences and we try and convene around things. So, for example, I don't control or oversee health and social care, that is local authorities, or NHS care, that's separate again, or education, that's separate again. But what we can often do is set standards, make it really clear what the experiences of people are, so that we can start to convene and have those challenging conversations with people about the way that they are or aren't sharing information. And this is a very complex area, of course, because different carers will have a whole different set of organisations that they're dealing with. And I think the key is to keep working with people like Newcastle Carers and the other organisations who are represented, so that signposting is more accurate, and also supporting people to find places like this, because what we'll know is that for every single one of you who has, there'll be, how many you haven't? Hundreds? And so kind of that targeted support, I think, is critical. And then I think the other thing, and this is not something that, but making sure that we're making those interventions as early as possible with our young carers as well. And trying to make sure that signposting is in place from the very beginning, identifying who needs the support, because I think people suffer in silence too often, and making it very normal to seek it. So I don't have a sort of one-size-fits-all answer for you, but what I can say is that we recognise that it's an issue, and when we're looking at how we reform public services and draw everything together, we're looking at how we take some of that complexity out and convene these organisations so that they talk better together.
That's good. Yeah, thank you.
Thank you.
Can I follow up on that? Kim?
Please.
Just to say that I think that as
I have wondered why you're not sat at the front.
collective organisations, as a collective of organisations, I think we would really commit to that idea of convening at that strategic level across the combined authority. And if there was that kind of commitment from your end to be able to help us pull that together so that it has the clout that it needs, because that's what we want.
Through the organisation, we can absolutely look at how we might do some of that. I mean, we all know what I'm going to say excuses, and they're not excuses, because it's not fair to say that. You know, what you'll know as well as anybody else is most of the frontline professionals who are working in all of these places. Everybody is well-meaning. Everybody's doing a job. Everyone's doing the best they can. But, you know, it's when you start to hit the barriers of things like GDPR and all of those things, and what we need to be finding is solutions and not problems. And I think, you know, we can definitely look at how through the combined authority, through the organisation, we can help to do some of that convening. Because it does remind me of that story, you know, and I've met so many families in that situation.
Yeah. It feels sometimes like the systems don't talk to each other.
Oh yeah, and I think they don't. Yeah. And
very siloed.
Yeah, and we were just talking upstairs about how sometimes actually, you know, we make the assumption that people think like, so, you know, we work in, this is Newcastle local authority, the South Tynes local authority, and actually people don't live their lives like that. You don't think about it when you are on a bus and you pass between local authorities. You don't go, oh, I'm in North Tyneside now, all of the services have changed. Of course you don't. You just live your life. Whereas, you know, those are people who deliver the services. That is how they have to think. And so we should be much more about person-centred, about kind of how we approach these things. Thank you. Right. We've got Michelle. Michelle Gilbert.
That's me.
Hi.
Thank you. Can I just say first though, North Tyneside carers are brilliant. They completely changed my life.
Yeah.
I just thought before I say my question.
Thank you for sharing that though.
And I've also got cold, so excuse me husky voice.
There's like things like that though. That is true, isn't it? Because like I say, there'll be so many people who haven't found.
Well, I didn't know it existed. Someone just said go, and it just completely. I was a carer for my husband for 18 years, and it's just completely changed my life.
So
I'm not going to get emotional, so I'll ask me question and I'll go red. Right. I have been part of developing the regional commitment to carers. Will you sign and support the commitment to carers? And what specific action pledges will you take during your term to demonstrate this commitment?
So we've done it, I think. We've done it, and we should have done it earlier, but we've done it. And I'm so glad that we have, because I like to think these are things that we're already doing. So as I said, we've got 350 staff ourselves. This morning we actually did an all-staff away day. And I walked into the room and I was like, oh my God, I can't believe how many people work here. It's absolutely amazing. And they're all running around the region doing great things to try and make it a better place. But we know that a lot of them will have caring responsibilities. So we do have flexible working already. We've got special leave provisions in place for people, access to employee assistance programs and adjustments to help with kind of work-life balance and the commitments that people have. And we've gone above the statute. So the statutory minimum is obviously 20 days of paid leave. We've gone above that, which I think is only right. And then alongside that, we've got flexible carers leave. And then we've kind of taken part in our own employer accreditation scheme. So for anyone who doesn't know about it, and regardless of what organisation you're at, we've got SHINE, which is an employer accreditation scheme. And that is all about basically making the region the best place to work, because I just think there's no excuse for it. We should be the best place to work. And that's about some of the things that you'd expect, so pay, terms, conditions, all of those things. But it's also about things like caring responsibilities, access to trade union membership, all of the things that you would expect from a really good workplace. We've now got, it's like 300 employers signed up to that, I think it is. I'm looking to the team. Is it even more than that? More than that. Yeah, so hundreds of employers across the region taking part in that. And I think probably what we should do is, because obviously the charter is relatively new, I think it's probably something for consideration on the SHINE programme, where we should be saying, you know, to get at a certain level, actually, this is something that you should be doing. So we'll take that away as an action, so that we're not just improving the things that we do in our organisation, but actually trying to encourage those businesses and employers in the North East to think about this.
Right. Thank you.
Can I just add something to that? Because
please,
Northumberland, North Tyneside and Newcastle, we deliver the Working for Carers project, which is about supporting carers in work and working with employers. And that's what we want to talk to NECRA about. We've been having conversations about how we can link much more closely with Shine, so that we can have that influence and kind of connect things a bit better.
Yeah, well, we will take that away today and look at how we can do that, because this is the sort of thing where if it had existed when we started Shine, we would definitely have it, and so we should be working with it.
Great.
But what I do find, and I mean, you will have all had a whole range of experiences, some really good, probably some not so good. But what I do find with our employers on a whole in the region is you tend to be pushing at an open door. You know, there is a desire to do it, and sometimes they just need a little bit of support to know how to do it, particularly those smaller employers for whom, you know, they might not have had a member of staff who has caring responsibilities before, and they just need the roadmap and the opportunity to do it right. There will be loads of employers who are terrible at it, and actually we've got to call that out as well and deal with it, because, you know, this is people's real lives and it doesn't make you any less valuable of an employee.
If I can just follow up on the commitment to carers question just very quickly, with a cheeky ask, which you may not know the answer to, but to celebrate the commitment to carers, we have an event on the 10th of June where carers and organisations are going to really kind of put the flag in the sand, and we want to make a big splash, because our community, society as a whole doesn't talk enough about carers, isn't aware enough about carers, and we'd love you to be there to speak and share what the Combined Authority are doing. So.
If I tell you on this spot that I'll definitely be at a thing on the 10th of June, those people over there will kill me.
I know. That's why I'm looking at you and not them.
So we'll take it away and have a little look and see what's in the diary. But I will try my very best. If I've not already committed to something, I'll try my very best. It's great that you're doing that. And if it can't be me, we'll make sure that we're represented there.
Brilliant. Thank you.
Okay, thank you for your question. I hope that answers it for you. What did I get to? You were Michelle, so Victoria Elliott. Hello.
Me, Victoria sends her apologies. She took ill last night, and at the last minute I've been asked to ask the question.
What's your name?
I'm Marilyn, and I'm from Caregivers Connected Gateshead, and they do a fantastic job.
No, thank you, Marilyn.
Right, the question is, how will transport reforms such as improvements to the bus system help carers to depend on affordable and reliable travel?
So, this is something that we've been looking at for both carers, care leavers, people who are involved in care. So, what we are trying to achieve is a much better bus service, a much more reliable transport system, more integration so that it's much more joined up, basically safer services as well. So that's what we're doing with the public transport network, and we're getting there slowly and surely. So for example, we've done things like fixed our fares at £2.50 as a maximum for people travelling a single journey around the region. We've just put that onto the metro as well, the first drop in metro fares in 20 years. It's massive. We've fixed young people's fares at £1. We've made it so that care leavers can travel for free, which I think is a really important commitment for us. And we also have companions passes available as well, so that people who have caring roles can access more affordable travel as well. So we'll be doing more of that, but what we're always open to is ideas. And what we're about to do is an absolutely massive bus consultation. So we are in the process of trying to bring our buses back under public control. I absolutely believe that we should control our buses and not private bus companies, because what we've started to see is services decline, prices increase when they're in control of them, and we're just not getting the service we deserve. So we want control of them. That's a lengthy process. But where we are now is we're about to, this summer, start the conversation with the public about what they want their bus service to look like. And that's everything from routes and fares to the experiences that people have had when they're using public transport to kind of what it is that you want to see. And so I think that what we need to do is make sure that that consultation, because it is a real consultation, I want this to be massive. I don't want us to be putting a thing online for 6 weeks and just seeing what comes in. Like, we want this to be massive. So I think we should send it to all of the organisations represented here so that you can distribute it to all of your carers and the people that you work with, so that we get that point of view. So that when we're thinking about a publicly controlled system, that we design for the people of the region, that we're taking more account of people with caring responsibilities. So I think we're doing some things already. I'm quite sure you have ideas about what we can do more of. And I think it's our commitment to listen to them and see what we can do.
Lovely. Thank you very much. I do have one idea, but I can discuss it later because I know you're...
I don't know. I'll go for it.
Okay, I'll go for it. My husband, who passed away in November, had a taxi card with Gateshead area.
Yeah.
And sometimes carers, they are given, say, 3 hours to go,
Yes.
a bit of respite for them, to go and do whatever they need to do. You go and get a bus, you might miss a bus and wait 20 minutes, half an hour for another bus to come along. Might a taxi card system be considered for carers, for young carers?
I am reaching into the depths of my memory, and I think there is something like this that exists already, but I can't remember the details off the top of my head. But I think it's a good idea, and we'll find out what there is and come back to you again through the organisation so that everybody's got the information. But if not, we'll take that idea because I think it does make a lot of sense. And actually, we sometimes don't really think about taxis as an option in the same way as we do about buses. We want them to be accessible, we want them to be frequent, but with the best will in the world, it does take longer. So yes. I think it's a good idea. I do think there's something, but I can't remember off the top of my head. You'll forgive me for being honest, I wouldn't lie about it. I just can't remember.
Thank you very much
for
that.
Okay. So, Julie...
Yes.
Do you know
the companion pass?
Yes.
Are young carers included in that? So sometimes young carers...
I think so.
Aren't included in certain things because of the age bracket. So it was just a question.
I think so. And if not, then we should look at that because... So I've got... Don't be a companion card, young carers who benefit from companion card allowance. It doesn't say anything about young people doing anything.
I think they are, because it's just someone to travel for free with, like, the companion pass actually belongs to the person with the disability rather than anyone else does.
Yeah.
They just get one person.
That's right, yeah. And actually, we made a commitment to young carers as part of our Child Poverty Action Plan recently. So yes, they do.
Thank
you. No worries. And obviously...
A little follow-up to...
Of course you can.
Transport question. So I'm Jenny from...
Transport always gets people talking.
Yeah, well, where I live... So I live in southwest Durham, and I'm actually Chief Executive of Durham County Carer Support. And I just think a lot of what we hear about that sort of big northeast picture tends to feel a bit like we're forgotten in southwest Durham.
I understand that.
I mean, we don't get buses on a Sunday, literally. So if you've got someone in hospital, if you're a carer and you've got somebody in hospital, you can't visit them on a Sunday. And actually, you can't visit them, you can't get back on an evening from Darlington to where I live. So it's that sort of massive problems for people.
It's a huge problem. And actually, you say that we've not forgotten. We are hyper aware of it. And that's why when we're looking at bringing the buses back in particular, the more rural elements of it are the first things that we want to deal with. I went in May last year, I went out, it'd been April probably, I went out and knocked on some doors in a place called Whitton-le-Weir.
Yeah, that's near to where I live.
Beautiful, beautiful place. Yeah. And I was walking past the bus stop and I just had a nosy, because you just do, don't you? I just had a little nosy, I was like, what's going on here? And it just said no service on it. It had a school bus, Monday to Friday, and nothing else.
Yeah.
And I messaged the team and just said, how is this real? It's not a small village.
No.
It's a pretty sizable place. And actually, the WI from Whitton-le-Weir came to me and said, look, we've got an idea as to how we could run something. So we're talking to them about that. But that's not the permanent solution. The permanent solution is controlling the buses. And where we are at the moment, Durham is the area that's received the most cuts and the most fare hikes and has the most patchy service.
Yeah.
And so we want to fix that. Now, I think that we might come up against some opposition from the council on that. And actually, we're going to need people's voices to be really loud about it, because I don't care who's in control of that council. I will not have them stop us from improving people's buses, because this is something that we get more contact from residents in County Durham about their bus service than anywhere else. So I totally agree with you. We're on it. We've got to have control of them first. We do put loads of subsidy in to maintain what's already there, but there's so much more to do, and nobody's forgotten our promise. Perhaps we should talk about it a bit more. Thank you.
Good.
Yes.
Just follow up on that again. So, after May the 7th,
yes,
it seems quite likely that your cabinet might look a little bit more, well, less diverse in some ways, but more diverse politically than it has been in the past.
Yes.
How confident are you that some of the things that you're wanting to do will still be possible?
I think that it's an honest, if I'm going to give you an honest answer, I think there will be some things that will become more difficult, and that is just the truth. And I think that, when people are thinking about their choices on the 7th of May, publicly controlled buses, more support for carers, more support for young people, more support for older people, looking at child poverty, all of these things that we've been working so hard on. I don't want those at risk. Green energy, it is a huge political dividing line, which it shouldn't be. These are really good jobs for young people who are growing up in the region. So I don't want these things politically weaponised. These are good things for our region, undeniably good things. Being able to cap the bus fares and the metro fares, all of those things. But yeah, you're right, it could be more difficult. I would like to think that anybody who stands for election for any political party in this region has the best interests of the people of the region at heart. I would also like to think they would take very seriously the mandate that I have, that I was elected to bring the buses into public control and to do these things. I've said exactly what I want to do, and people have made that choice, and I sincerely hope they respect that. But, if they don't, I will, by hook or by crook, deliver everything that I physically can, because it's too important for the people of the region. This has been a huge moment for us, having more power here. For people in caring responsibilities to be able to sit and talk to a politician who can do something, that didn't happen before, and now it does. And so I think demonstrating that that's what we're doing is going to be really critical. But it's a really valid concern, and it's one I obviously have. It won't surprise you to hear. Oh, yeah. Shall we carry on with our list? Maggie. I've got Maggie Campbell. Hello, Maggie.
I'm speaking from personal experience.
Thank you.
Many carers are unable to access meaningful respite because there are so few suitable local options for the person that they care for. This often leaves carers exhausted and at risk of crisis. What will you do to improve access to appropriate respite provision so that carers can get the meaningful breaks they need?
I think it's a really good question. And this is one that, again, so in my role as mayor, I don't have oversight of those services. So often they sit either with a local authority, or there'll be private services, as you know, or they sit with NHS provision, or perhaps somewhere else in the system in adult social care. And so those aren't things that I can influence, essentially, but they are things that I can help you to amplify your voice on. And so I think one of the things that we always do from these sessions is make sure that when we hear concerns and real life stories, like, real life experiences like yours, which we're really grateful for you sharing, is that we'll go back and say, we had this meet to the council or to the authorities, we had this meeting and these were a list of the things that were raised as concerns that we know are things that you oversee. So we can help you to amplify your voices. We can work with the care organisations to help facilitate some of that. But it isn't something that is fortunately in my control. And I'll never not be anything but honest with you. I'd love to sit here and say, would love to deal with that. And I think I know what we're dealing with. But yeah, I think it isn't something that I'm empowered to oversee. It's something that we can help you raise your voices on.
Thank you for your understanding.
Yeah, thank you. Thanks. Lisa Mordew.
What can be offered to the regional carer organisations to help them support carers to increase awareness and access eligible benefits and welfare rights support? A good offer would be something that would really maximise carers' household income and inject cash into the local economy.
Yeah, completely agree. So we are doing some of that work now but badged as our child poverty work. So what we've done is like more school gate support through organisations like the carers organisations, community organisations, to help people to access the benefits that essentially they're entitled to, because there are so many people. And as a result of that direct support, we've put millions into people's pockets and back into the local economy. And of course, much more importantly, made people feel more comfortable. And so I think having that conversation about how some of that could potentially be expanded into carers organisations and spreading the word further so that it isn't just under the child poverty banner. Some people might not have children. You know, I think it's a really good idea. And actually, particularly when we've already got the expertise to do it, we should be doing more of it. So thank you.
Thank you.
Okay, Janet Potts. Hello.
I'm going to change my question at the last minute, which might not be the right thing to do, but only because I think you've already answered the one that I had, which was how to encourage more employers to adopt their carer-friendly policies, including flexible working. But I think from what you said earlier on, you pretty much covered that kind of
Yeah, well, I think we've got Shine, and we want to get it out there as far and wide as possible. Again, like I say, you know, we've 300 plus employers in the region. That's tens of thousands, if not hundreds of thousands of people in the workforce who are covered by that now. But it can always be improved. We always said that it was a work in progress. We always said that there'd be more to do. And so we're definitely committed to doing that.
Yeah. So my additional question now is, what do you think you could do to help carers, particularly men, for example, see themselves as carers and encourage them to find help?
I think that's such a good question. And you know what, I'm going to be honest and just say I think we would need the support of the organisations that represent carers to do that, because I don't know that there's one answer, is there? And I think sometimes the hardest part is getting to these people, because everybody has busy lives and carers have busier lives than most people, and often people are just in the day-to-day doing what they do every day. And I think, and it isn't the same, so please bear with me when I say this, but one of the things we did when I was Police and Crime Commissioner, and I think it's something that could be explored through the care organisations, is we supported people that you wouldn't necessarily expect to have the conversation, to be able to have conversations about violence and domestic abuse. And I think there's something about, the barber, the hairdresser, the people who you see day to day, who actually you're much more likely to have an organic conversation about your life with, rather than, walking into a professional service and saying, actually, I need help. You're much more likely to, the woman who does my nails knows everything about me. And I think that's common.
Yeah.
I think people are much more likely to have an organic conversation in a normal setting than they are to, walk through the door of a support organisation first of all. But obviously what we know is that when they do walk through that door, it's a really transformational experience, like we've heard from people around the room. So I think that's something that we could explore, or that you could explore. But I think there are probably people better equipped to answer that question than me. And that's the truth.
Okay, thanks.
Thank you.
Can I follow that?
Yes, you are better equipped to answer that question than me.
I'm not going to answer that question.
Yes, you are. Please do.
But I think there's a point underlying this, because to amplify carers as a thing, to get that kind of presence within our communities and understanding within our communities, it requires resourcing, it requires key people making kind of statements and talking about the subject, and I think particularly in terms of that resourcing, I think that's a real challenge, because we're small organisations that yes we are, and we have worked together, and we do that not because we have time or resource to do that, but because we believe it's important. But when we talk about amplifying carers, funding comes through combined authority and local authorities for interventions, for and support, which is vital and brilliant. But actually, one of the things that we need in terms of the carers agenda is that amplification of that kind of that word, or that role of a carer, and we need support to be able to do that. And I think that there's some interesting question, because there's not, there aren't calls to say, do some promotion around a demographic group of individuals. That's not a thing that exists.
Yeah.
So how do we get to that place?
Yeah.
It's really tricky.
I think it is tricky, but I take your point, and I think we can look at how we can help. Thank you.
Can I add to that? And not just a group carers,
because I think quite often young carers are forgotten in the carer scope, because it is that kind of generic carer. It's a bit like when we talk about carers, and a lot of the families that we work with think they have to have a physical disability, and it's encapsulating all of the other things. Like a lot of our referrals come for children with additional needs. So I think as well, just highlighting young carers as a separate category as well as carers, because they are just as important. But I think it's helping people to understand that children do have that caring role, even if they're not doing that physical care, and it does have an impact on them as well. And that's something that our young carers kind of say quite often. And the same with Shine. I don't know if young adult carers are explicitly mentioned, but again, when we talk to our young carers and they just say carers, they say it as an older carer, not kind of themselves. So just the word, and that is maybe used to include young carers and young adult carers as well as carers.
Yeah, I mean, we can definitely look at that. Shine's an employment scheme, so wouldn't be applicable to young people, to children who are carers, but the people who are transitioning into their first jobs, into work. I think that's really critical, and particularly when we're thinking about those workplaces that are often the most accessible to people taking on their first jobs, are often also the least flexible. Things like hospitality service industry, retail, they struggle to be flexible in the same way as for us. There's loads of us. It's much easier to be flexible for an organisation like this. You understand it's much easier to be flexible, but if you've got to open a shop every day, or you've got to open a restaurant every day, it's much more difficult. And so support for how you might do that, and also some road mapping as to the measures you can take, and recognising it in your staff. I think that's a really good point. Thank you. Yeah.
It's just about young carers, really. So I have a young daughter who is only 5, and I have a son who is now 4, but he has complex medical needs. He's on oxygen, ventilator, feeding machines and so on. But until she was 5, she couldn't get any support. So I was living in hospital for like 2 years, pretty much, and there was nothing available for her because she wasn't eligible until she was 5. But yet I needed that support, and she needed that, because I was taken away from her. She'd never met her little brother for a very long time, and it was huge. And there's a huge gap there for those very, very young. And they always say that actually to get them young and support them and give them that, but actually there's nothing. There isn't anything for those.
Nothing, for children who are
so sad. So she's
impacted by your caring responsibility.
And then she's had to take on that massive caring responsibility as well. She can't get that time with me or her dad as much. And she's gone to school. She suffers with her emotions quite a lot now, because still now I'm in and out of hospital all the time. But had that support of being there a little while earlier, maybe it's just talking therapies or something like that, someone who she could talk to, confide in, having that at the beginning may have helped her and being able to benefit. And I think having something like that for children that are going through that is a massive, massive thing, and it's a huge gap.
No, thank you. I wasn't aware of that gap at all, and the fact that there's no support available for very little children, but so important.
There's no age limit, is there, really?
Oh gosh, no.
It's not their fault that they've had a little brother or a sister being born that's really, really poorly, and they've had their family ripped apart. So there's nothing there. The only support that there is sometimes in the hospitals. But then that's very, very difficult to get, because those are helping those families that have got terminal illnesses or children that are going through cancer and all those kind of things. So it's really tricky, and the wait list could be huge. Whereas if we could give that support, it would be massive.
I think that's really useful. And there are settings in which that would fit. So some of the family hubs, family services, those places that, play groups and all of those sorts of things. And actually, when we're thinking about how, because again, we don't oversee those services, but what we have done is invest in, for example, that kind of play provision, childcare, support for, again, families on low incomes. But that provision, therefore, exists, and so embedding some of it within I think is something we can take away as an idea. But I was just not aware of that as an issue.
Yeah, I think ideally that setting isn't really that good because you would have to take them there, and then you can't because you're in hospital. They need someone on a one-to-one basis. They need to have that support and have someone that they can talk to and open up about their feelings. Going to a group like that, I mean, when Marco did come out of hospital for the first time, I was very agitated on taking him anywhere because I've got so much machinery and things. But I did take her along to some groups that I was able to, so she could meet other children like Marco as well, and so she could meet siblings and things. But I think while I was in hospital, it would have been fantastic if there was someone able to just come out and spend some time with her, have some one-on-one time with her, talk to her and that kind of thing.
I think that's the sort of thing we can take away and again amplify the voice of, because I think I just didn't know.
Yeah.
And that's why these things are so important, because you just don't.
No,
and
you don't.
It's remarkable, isn't it? Because when we talk about opportunities for children all the time, and starting as early as possible, those very formative years, and that is her most formative years, isn't it?
It's where our brain's building, so all those emotions, those first 5 years, it's massive.
Oh, thank you for telling us.
No
about
problem.
it. Thank you.
Thanks.
Yes. You're fine. That's what we're here for.
Thank you. My addition to that would be when we talk with our young carers, they always say to us, how do adult carers get so much money and we just get a little bit? So I think amplifying the funding for young carers as well, through obviously the child poverty scheme and however else we can do it, and amplifying their voice, because I think that people do want to support young carers, and like you say, they are those formative years, and we do want that early prevention, but without the funding to be able to do that, we end up then, when they reach crisis point, we're then chucking them at loads of other services, whereas if we had got them at the earlier stage, and that is something that our young carers say all of the time, like adult carers have got so much money and we get not as much. So I think it's obviously having their voices heard in those rooms as well.
Thank you. That's really helpful. Thank you. I've lost my place. Has Janet gone?
Yes.
God.
I think we might have skipped Julie. I think you said Julie, but then moved on to the...
Did we skip Julie Thompson?
Yes. Well, yeah.
I'm sorry, Julie.
I've got a list of things.
What am I like? Sorry.
Depending on where you live in the northeast will determine the type of and level of care you receive. We often have to fight to get our loved ones seen by the right healthcare professionals. High level of healthcare should be available to everyone, not just based on your postcode. So my question is, how can we improve collaboration between healthcare professionals to deliver seamless, high-quality care while ensuring family carers are properly recognised, supported and included as essential partners?
I feel like you've asked and answered your own question, haven't you? Which is like the whole point, is you've spelled out how it should work.
Yeah.
And also how it doesn't, or how it does in some places it doesn't know this.
Like if you live in South Shields, if you live in South Shields and the service isn't there, but it's in Gateshead, you can't go to that service, or you have to fight to get to that service. So it determines what level of service you get and what kind of treatment you get. Or if there is no treatment and you have a look and you have to pay for the treatment elsewhere, so you go and you find the treatment that you need, you get the plan put in place, you get the support there, you bring it back to here, you then sort of told that you're doctor shopping, and that level of, you're doctor shopping. So basically
I've never heard this expression before.
So you've actually gone and looked for it, but that service is somewhere else, but it's not here. So because it's not here, but you've been told that care could happen if you lived somewhere else, but you bring it back up here, but you can't have it up here because they don't have that service here, or they don't have the money for that medication or for that treatment.
I see that, and this is one of those ones where we don't have control of health and social care or of the NHS or all those medical professionals, but I think the amplifying your voices point, taking that away, making sure that our ICBs and ICPs, so integrated care boards, integrated care partnerships, local NHS services, know that we've had this conversation, that these are the things that have been raised, and again amplifying some of this with government about that joined up approach. And I think in that sense, the NHS is getting better, but we need it to be faster, don't we? Because actually, there are so many, when we talked about this upstairs, there's so many places whereby, I don't know, you might live in North Tyneside, but you might be closer, for example, to a hospital in Newcastle than you are to Rate Lane. Or you might live in Northumberland, but you might be closer to, and this is a really common thing. And we shouldn't be expecting, I don't think, people to live according to their local authority boundaries. We should be adapting to people's lives. Now, that's what I believe.
Yeah.
But as I say, I don't control or oversee those services, but we will absolutely share your experiences with those that need to hear them.
Or you get to the professional you need to see, and they diagnose you, but then they're told that they can't keep you, so they have to dismiss you because you're not in their postcode.
Again, it shouldn't be like that. And so I think this is something that, particularly for those with care responsibilities or complex needs, we'll share that information from this conversation and people's experiences, and try and encourage and convene around some of this.
Yeah. Okay. Thank you.
Have I missed anybody else though before I move on to the last person on my list?
But I was just going to follow up just in terms of that convening again. It's a similar thing, and actually it ties into what we were talking earlier with this kind of some of these systemic kind of challenges, and actually it's really important that we get all those right people in the room to be able to have those conversations and hear these stories actually as well, because that adds that kind of real motivation, because there's a reality there for people.
It really does.
There's a dark side to that as well, because my daughter's had friends who've actually, are no longer here because they couldn't live in the pain, and they couldn't get the treatment that they needed. So they are no longer with us. Because if that had been available, that service had been available to them, then it would still be here.
Yeah, I understand. It's a real impact. It's a life or death situation for a lot of people. Thank you.
Such a powerful thing to be able to bring us together,
hugely,
Kim, I think. So that would be, that's really, really powerful if we can get people in the room talking about these vital things.
Thank you. I've got one more person on my list, and that's Kirsty. Hello. Hi, Kirsty.
First of all, thanks again for giving your time and coming and listening to all of us here, asking your questions. I know it's probably not the easiest thing to do.
I'm learning a lot. It's seriously, because I don't walk in your shoes. I just did not know. About that. I didn't know doctor shopping. What is that?
I know, it's insane, isn't it? So my question is probably, it's been echoed quite around the room, very similar, and I know everyone's probably going to have felt this, but how can parent carers' voices be integrated better into key decision making, both operationally and strategically? So for example, we often feel like our voices are just not heard. We can go into meetings with professionals and they're not listening to us, but we know our children, the people we care for, we know them, we know exactly everything about them, but yet we're pushed in different directions. So how do we get that?
When you say decision making, can you give me, do you mean in the wider sense, so when we set policy for something, for example, or do you mean in individual cases about the care your young person receives?
I think it can be both.
Both.
Yeah, absolutely both. Because I think people write stuff, they'll write these, will come out with all these manifestos and everything and all these brilliant things, but yet they haven't listened to what we've heard. They've not spoken to us. They've not taken our feedback on board. But also in the other instance of we may have an occupational therapist come out and say, we recommend this bed for your child, but actually that bed does not meet their needs, but actually it ticks a box because it's a bit cheaper, but then they want you to get it, but then in 6 months' time it's no good and then you need to get another one anyways. So those kind of things as well, but I think it's wider, it's huge.
The irony of everything there you've just said is that the bigger thing is easier than the littler thing. And which it shouldn't be like that, right? Yeah. So if you're having a one-to-one conversation with, a doctor or an occupational therapist or someone along those lines about the needs of your child, that should be a much easier conversation. But for a whole host of reasons that, again, I'm not in control of, it isn't.
Yeah.
Whereas actually, the wider sort of parent-carer voice or carers' voices in the policy setting, the decisions that we make, that's actually a lot easier for us, for me. You know, because when I think about the way that we, for example, have made decisions on our child poverty programmes, we have integrated those voices of people with complex needs and parent carers and recognised that actually a number of our beneficiaries will be people who don't earn enough because they have caring responsibilities, and that's why they're in poverty. You know, and so when we are thinking about public transport, for example, you know, we will endeavour to we'll come out to organisations like Newcastle Carers and make sure those voices are amplified. So we do lots of that and can do more of it. And would love to hear from you. But
I think that would be great, because I think also we talk about a lot of people in poverty, but what about, I've just gone back to work after 4 years of not being in work. And when I went back
How's that?
Really challenging, because I've got like 4 appointments a week with Marco. I'm travelling to Leeds, the Freeman, everywhere. So it is really, really challenging and really difficult to get both my children to different schools, because one's in a special needs school and stuff like that, and he doesn't qualify for transport yet, and stuff like that. So it's been hard, but I'm lucky I've got a very nice boss who's really, really understanding, which has been massive. So that's great. But it's about those people who have gone back to work, but yet they do, like, because I earn money now, or I get this much money, oh no, you don't qualify for any of this, you don't qualify for that, you don't qualify for this. And it's like, I'm going back to work because I'm trying to help my family, but actually you don't see that I haven't worked for 4 years and I've put everything on credit cards for the past 4 years.
Yeah, completely. And I think, and I totally see that. And so I think it's across the board, isn't it? In lots of different parts.
Definitely.
So we will absolutely commit to making sure those voices are heard in all of the conversations that we're having about the decisions we consult on.
Yeah, perfect.
But I think the other bit is the advocacy that amazing organisations like this provide about those one-to-one discussions, and so much better placed than me to support you with that, because again, we don't oversee those NHS or adult and children's social care services, but I think letting them know the nature of the conversations, and I think some of it, you know, where you're like looking at it and you must look at it and you must think, helping you to save money, for God's sake.
Definitely.
And it's dead frustrating. I've seen it, I can see it. But I think it's these brilliant organisations.
Even like the hospitals don't link up. Mark was in like 7 different hospitals. They don't link up. So they can't get the records from what his bloods have done at one hospital to others because they use a different system. So then I have to carry folders this thick with me to every hospital that I go to, because they're going to ask me questions on that because they can't get it on their system because that was down at Leeds or that was at the Freeman.
And you're thinking about that as well as transporting your son with extreme complex needs, as well as all of his kids,
equipment,
as well as his sister, as well as, and actually that should just be an automatic system.
Totally. And they're like, oh, sorry, I've got to ask you this, and I'm like, why could they not just marry up? But how do I have to tell you everything? It's just so soul destroying.
And I mean, that's a massive level. I remember that I went to an appointment at one of our local hospitals. I won't tell you which one. And I went to reception and she handed me a folder and she said, "Can you take that in with you?" And I was thinking, do you not have a system for this? Is that not electronic? Can she not read it on the computer? But that is like that is tiny, and that's you all the time. I hear you, and I think we can feed that into the Department of Health, and we can feed it into the hospitals' trusts, and say like, why aren't you talking to each other? Because actually, when it comes to those GDPR, they have those systems in place.
Yeah, definitely.
So we'll raise that and let them know that we've had the conversation. I can't promise you action.
Yeah,
but I can promise you that we'll tell them that we've had it.
Yeah, thank you.
That's my list.
It's
but
not
I've got
quite,
a
sorry, Kim.
I've got a longer list.
And I was meant to prepare, but then I got distracted earlier. So we've got a young carer, or some young carers from Durham who have prepared a question. However, they aren't here.
That's fine.
Because things happened over the last 24 hours that meant that they couldn't be here.
Was it our bus service?
It wasn't. I would have said if it was.
Yeah, I'm sure you would.
So the question that was posed, and apologies, this is my voice and not one of the young carers. What are your plans to support the mental health and well-being of young carers, as well as adult carers, parent carers and sibling carers?
Again, this is not a thing that we oversee as such, but it is a conversation that we've had with people like Tyne citizens about mental health support in schools. And actually, I've been really pleased to see that government are starting to put more mental health support into schools, and we'll start to see that rolled out. Now, we want it quicker and we want it to be as broad as possible, and we don't oversee it, but I think it's a really critical thing. So obviously, we've got our one-to-one support in Newcastle, and I would love to see that go out further across the region. And I think that equal access, regardless of where you're from, is really important to us. But I think, again, raising the voices of those young carers and saying this is a real need is really important.
Yeah.
Thank you.
Thank you.
Is that the last one?
That is the last one, yes.
Right, so I think we've got like 10-15 minutes. If anybody has any more questions, I'm more than happy to take. Or ideas and thoughts and views. And
if you don't mind, thank you.
Yes.
Thanks very much. Well, I was just listening to discussions, and in particular, I was also thinking about my daughter. I've got an elder daughter who was also my carer for a while. And she wasn't able, so you mentioned child poverty earlier and the poverty strategy, etc. So I'm currently on benefits, and what it is my eldest daughter, who is now in higher education, but when she was my carer, she was below the age of 18 as well. She couldn't tap into any carer's allowance or any help, financial help, because she was in education of 35 hours or more a week.
Full-time education.
Yeah, full-time education. I have got another carer now, but she was going to be my carer as well at a time, certain point in time. And because she's now in higher education, she's not entitled to any help either. And it's not about the financial. I'm not trying to say she just wants to tap into benefits, but it just seems a little bit...
Well, it'll stop her from working, though, alongside her studies, won't it? And it'll stop her from...
but she does still occasionally pop in and do a bit of care work as well for me. And it just seems so unfair that young carers are not entitled to any remuneration, if I'm making sense. Or
if they're in, particularly if they're in education.
Particularly if they're in education. I mean, I do understand if they're, for example, under a certain age, they can't tap into it. But it was just, she was fairly, quite mature. She was sort of 16 plus when
Working
she was...
age.
Yeah. And if it wasn't for the carer centre, I must say, who supported my daughter at the time she was caring for me, I don't know how she'd, how we'd have coped, because I'm not a rich person myself.
No.
So I would have had to use my money to kind of,
support her.
Yeah, to support her, basically.
Yeah, I think it's something we can, again, we don't oversee the benefit system, and I'm going to be honest and say I'm not an expert at all in how those different benefits work. And I think, we are seeing some changes, some for the better, some for the worse, but I think we can take that away and get an answer, because I don't know it off the top of my head. Yeah. I think the other thing that we do know, and you will see all the time, is there's a huge number of people who are entitled to something that they're not getting. And that is so important, particularly at those transition points where quite often there is more than people think there is available. And so I think we need to be better at telling those stories and promoting that. And I think it was a question earlier on. And so I think that's something that we can take away.
Because nobody tells you otherwise.
Well, no,
of
course they don't.
Forthcoming kind of thing.
Yeah, of course they don't.
Yeah.
All about gatekeeping.
Yeah, it makes it really difficult to access something that you're entirely entitled to and that, will hugely improve your life. Yeah, please do.
Thank you, ma'am.
Thank you.
I've been pretty much a full-time carer since I was 8 years old. No support, no carers apart from myself. For my mum, who had a subdural hematoma on her brain, an ex-nurse, so she's a clever lady, but unfortunately not as much now. It's what I struggled with is that I only knew about carers allowance last year, and I think that says a lot about how it all is filtered down from being information that you want to explain to people.
And obviously you look 18, but I'm presuming that you've been excluded.
I'm 28.
I was going to say, but you've been excluded from something you've been entitled to for a very long time.
And again, going back to, I can't quite who said it, but when you have got the carers allowance and you got returned, I think it was a lovely lady over there, returned back to work, your caring money goes, but the responsibility doesn't.
No.
And it's that I have a little bit of a, where's that grey line going to be? Because realistically, you're still having to provide that care. Yes, I was told that I had to return the money, which I had no option but to do, and I was understanding that I had used more money than I had because I was working at the time. But even then, I didn't know that. So I was never told I had exceeded a limit. I was never told that I would be prosecuted. Alongside, I had my own health conditions. I had subdural, I've got rheumatoid arthritis. So I struggle with obviously hand motions alongside caring for my mum and then working on the side of that. So you can imagine it was a massive whirlwind.
It's very complicated.
Very complicated. And unfortunately, I had to step away from work, but I struggled to get back in with my mum and caring because of my own health condition.
Yeah.
So again, it was a big cycle. And I really think that if I had the right information at the right time, I would have been able to support my mum better. And I think for anyone that is caring, that is our main priority. We want to make sure that people we are caring for really do not just get the best treatment we can provide, but if we were in their shoes, we would want to be looked after just as well. So I think for everyone around, it's that same thought of going, well, how can we get that information that obviously you're so capable of providing to be in the right place at the right time?
Yeah, and this is why we've got to work with these brilliant organisations, because they are the experts. And, from what you're saying, and I'm not an expert remotely in the benefit system, but there's lots of crossover spaces where you probably would have been entitled to bits and bobs. Ramping up of either universal credit or of carers allowances.
Even that, I didn't even about universal credit, because I was working and I had enough money. Luckily, gratefully, I had enough money behind me to
and because you're busy.
Yeah, to not
because you're caring for someone and you're working and you've got a life.
And then now I've then had to go through the universal credit system and on benefits and stop potential work for the future. And for me, I'm also like, well, what is there any help out there to help me get back on the work ladder and stuff like that?
And we will pick up with you after and help you out with that. Because I think that's the other thing is that we've recognised that a lot of people who care do want to work, but there has to be the right access.
I think it's the transition from being a young carer into actually being an adult carer and knowing that your job isn't a carer.
Yes.
And I think that's what a lot of young carers aren't taught or learnt, or if you were able to actually have that therapy, being told it's not your responsibility, because I wish that my parents had told me that when I was younger.
That you could step away.
That I could step away, whereas now I know I can't, because it's so ingrained, as you were saying, as your younger years are so important, you do it out of love, versus as you get it to an older, it does make it more challenging to step away and not feel that guilt alongside it. So if there was a bridge between that would be fantastic, but I know it's difficult.
Well, through that Trailblazer scheme, it's a huge part of it. So we'll hook you up with some of that after.
Brilliant.
But I think you both raise really good points on benefits and raising that awareness, access to what people are entitled to. I think that's something again we need to help amplify voices on.
Brilliant.
Thank you.
Thank you.
One more question.
You can.
Sorry. This is about young carers as well. So, do you know how having time off school?
I feel like I probably don't know how. No, I do.
So when you have time off school, you now get fined if you're taking holidays in the school holidays.
Yes.
However, when you've got a child with huge complex medical needs and you have to then pay for oxygen to go on holiday, and you have to pay for all the other medical equipment, and then you're going to get a fine, is there anything that we can do to kind of put in for these young carers some support for them to be able to have a holiday? Because holidays in the school holidays are so expensive anyways, and then you've got on top of that all of your medical equipment that you need to pay for because you can't take NHS medical equipment away. You then also... Your child can't cope because it's so busy as well. So why should our children miss out on these fantastic life-changing opportunities to be able to enjoy family time? So is there anything that we can do to kind of see about that?
I don't know. Because you raise again a point that I just would never have thought of. And again, we don't oversee schools. We have things in schools, so we do lots of stuff about early opportunities and skills and careers and all of that kind of stuff. But that element of running schools or academies either sits with the local authority or with the Department for Education. So I think you raise a good point. Again, we can raise it.
Yeah.
But I don't know the answer to your question.
Okay. Brilliant. Thank you.
I'll always be honest.
No, if you could just raise it and highlight the fact that these kids
are missing out, and it's a massive gap for them as well.
Yeah, completely.
Thanks.
I think, sorry, I can't just
Please do.
interrupting there, thank you. I think for me, the more challenging has been young carers at school not being supported at school.
Yeah.
I've had a huge challenge with regards, I mean, sorry, I'm going more personal here, but my youngest, I mean, both of my two children are carers because I've got a lot of health problems as well. And I've got additional needs. Child who's very complex and he's been out of school for nearly a year now. And my youngest son hurt his foot. He cut his foot, so he couldn't walk on it for 2 weeks. He couldn't do any physical activities. Now, because my other son was out of school, the school were never lenient with the punctuality letters. I was getting punctuality letters like nobody's business. So when he did hurt his foot and I said, can I use the car park? The reply I got was, no, well, it's all right, you could come at 9 o'clock. But if I did come at 9 o'clock, they wouldn't let me through anyway. So it was late. So it was like, it was a hypocrite. Is it a hypocrite, I would say?
Hypocritical,
yeah. It was very, because, so they weren't supposed.
You're just stuck, aren't you?
I
Like
was just stuck. So my both children are young carers, but they've never had that support. So at home, our family has been very disruptive at the minute with them being at home and with a lot of challenging behaviour, no therapy in place, nothing. And we've been just left to our devices to do it. But then I've had a lot of issues with my youngest son at school and there's been no support, even though there's been a lot of behavioural that never used to happen before with the youngest one. So I'm just wondering, like, what support would there be for schools to be a bit more awareness regarding the young carers, sorry?
I think often the truth, and you'll know better than me on this, unfortunately, it's kind of case by case, isn't it?
It is
school by school.
School by school, and I think there's some work, and part of the collaboration that we're looking to do is to start putting that intervention in place with the schools. So there's support for young carers in schools, but actually it's really important in terms of the culture, awareness, understanding, practice within schools that we're trying to focus on. So we're keen to kind of, we've pulled together. We just need that kind of funding to make that happen.
Yeah, I think that's great, and I think it's interesting, isn't it? Because when we've been thinking about the charter, the commitment, you immediately go to employers. You think about adults, you think about employment, you think about how you can adapt workplaces, and actually schools need just as much of support and a tap on the shoulder as much as anybody else. So it sounds like you guys are thinking about how to make more of that happen. I think if there's, because I won't ask you to go into more detail here, but if you want to catch us afterwards and we can help you with any casework, then we will try our very best to point you in the right direction and kind of give the school a bit of a nudge. We'll try our very best to do that. Thank you.
I think I'm very conscious that we're coming to the end of our time with you, Kim, and I know that you're not going to necessarily run out the door.
I did say I'm a terrible chair, and I'm always late.
But and I think that I just want to kind of say thank you for being. I mean, first of all, being really honest about where responsibility lies, because that's a really. And the thing is, we live our lives and we don't necessarily see those boundaries, and I think it's really important for us to understand where the different responsibilities lies, and that commitment to help us convene those people that have those different responsibilities so we can look at this as a whole is, I think, one of the most critical things. I guess there's something about hearing the voice and hearing people's stories, and I find it powerful. I found it powerful, so thank you to everybody who's shared, and I'm sure you want to say your own thank you, but for me it's really powerful to hear these stories and then think what we can do about it, because I think that connection is really important. I guess, and this isn't a question, you don't have to come straight back at me on this, but something to consider as a combined authority. It's powerful hearing these stories. How, as a combined authority, can you continue to hear these voices of carers? And where does the responsibility lie within the combined authority for carers? Because we can talk about employment, and that's great, and carers into employment, etc. That's great. But, we can talk about in terms of education. Is there the opportunity within your senior team to think actually somebody that can really have a gaze right across and make sure that carers is within the combined authority strategies moving forward? I think there's a question there to explore maybe. So that carers is always on the agenda and not forgotten and not an afterthought. So Anyway, that's my final blurb. I just thought I'd take the opportunity. But thank you very much, Kim, for coming and giving us your time.
No, thank you so much. It's been a real pleasure, and honestly, hearing your experiences, it is heartwarming, and at times it is hard to listen to some of what you've had to experience and how the system doesn't work for you, because when you're in a job like mine, what you want to do all the time is fix things and say yes and improve things and say yes, and some of these things we can take away, we can run with, we can do. Some of them, they're tricky, and they are about convening and doing a bit of the advocacy and saying this is something that needs attention and shouting about it. So we'll do all of those things. And I think your point about embedding it into our organisation, I think we're hyper aware of it, but I think sometimes what we do is, in a sense, because we're embedding it into everything, that creates 5 different strands, when I think allocating to one person and saying, can we embed this across the organisation, makes perfect sense. I think the Charter will help us to do that. It gives us that almost internal permission to say, this is what we have committed to, and we'll do that both in the work that we do with our own teams, but also the work that we do with others as well. So I just want to say a huge thank you. Thank you for hosting us. Thank you for everyone for coming. It's is it Wednesday? Giving your Wednesday afternoon, evening to us, it's really, really generous, and I do really appreciate it, and appreciate the time and the thought that you've put into your questions and your ideas, because we are listening, and I'll take them away as best I can. So thank you.
Thank you.
Thanks.
Thank you.
Thank you.